Good morning, everyone, or depending on where you are in the country, afternoon. Before we begin, I'll share just a couple of procedural things. You'll notice that the chat function has been disabled. However, throughout the presentation, you can use the Q&A function to pose questions to our speakers, and we will make time at the end of the webinar to have a lively Q&A with your questions. You'll also find that there will be a survey at the end of the webinar. You can take this either through the link that will be posted in the chat or through the QR code on the screen. The webinar is also being recorded and it will be posted to Ava's YouTube channel shortly, so you can revisit this and share it and any of our past previous webinars as well. Once I'm done with the introduction, I'll put that in the chat. Without further ado, welcome to the Alliance Against Violence and Adversities, or AVA's Webinar Wednesdays. I'm your host, Dr. Sara Heembrock. With AVA, I'm an early career researcher and lead on the webinar series, alongside my amazing colleagues Jason, Andrea, and Isra. Outside of that role, I'm the co-director of the Frida Center for Research on Violence Against Women and Children, which is housed in the School of Criminology at Simon Fraser University. And I am a teaching professor at Capilano University in the departments of Sociology and Criminology. Today, I'm joining you from the unceded, traditional, and ancestral territories of the Coquitlam First Nation. And on behalf of AVA, which is a national organization, I want to begin by acknowledging that we encourage all Canadians and visitors to Canada to learn about the Indigenous peoples of the lands on which they live, work, or visit, and become engaged allies together. We, as Canadians, in the spirit of truth and reconciliation, respect the self-determination of First Nations, Métis, and Inuit peoples, and their rights and responsibilities in cultures, languages, and the pursuit of wellness. The focus of today's webinar is engaging community on MMIWG plus prevention in Highway of Tears country, featuring Dr. Jacqueline Holler and Sara Heembrock from the University of Northern British Columbia. Dr. Holler is a professor of women's and gender studies and history at the University of Northern British Columbia and a member of the leadership team at the Northern Feminist Institute for Research and Education. Sara Heembrock is a Master's of Education in Counseling student at the University of Northern British Columbia, with experience working alongside Indigenous communities across student services, housing, holistic wellness, and social services in Northern British Columbia. Her work is grounded in Indigenous-led, trauma-informed, and community-based approaches, with a focus on advocacy, systems change, and strengthening access to culturally responsive supports. She is committed to bridging research, policy, and practice to advance safety, accountability, and more connected communities. Welcome, Jacqueline and Sara. It's so lovely to have you with us today.
Thanks so much for the introduction, Sarah. And yes, good morning or good afternoon, depending on where you are. And welcome to this webinar. I'm Jacqueline, as you heard, and with me today is Sarah, whom you see on the screen. And as you heard from her experience, Sarah is really an ideal person to have worked on this project, and she's been instrumental in some of the work we'll present today. And you'll also see Veronica Campbell's name on the slide, though she's unable to be with us today. Veronica is currently the Calls for Justice Coordinator at Carrier-Sakani Family Services in Prince George, BC. When we originally scheduled this webinar 9 months ago, the symposium that we're going to talk about was planned for earlier in the year. That would have meant our research would be further along. However, the symposium was rescheduled and it will now take place next week, and that's why Veronica is not here. She is busily putting the finishing touches on the symposium planning. So you'll hear something a little more in progress than we had originally planned. That said, I hope you'll come away from the webinar with a sense of how agencies, academics, and communities are working together in Northern BC, and how such partnerships might work for your region if they aren't already happening. And we're eager to hear about your partnerships in discussion, because ideally, this kind of work should be like a web with many nodes and points of contact from coast to coast to coast and from region to region. So we could advance, please. We have some, back to the acknowledgements. Before we proceed further, we want to acknowledge the contributions to this work. First, we respectfully acknowledge the traditional and unceded territory of the Lheidli Nation, upon which both Sarah and I live and work. And we want to acknowledge the many nations and individuals in Northern BC who have participated in our research. And I would say from the Northern Fire perspective, We want to acknowledge that strong partnership with Carrier-Sacani Family Services that we're very honored to be part of. We gratefully acknowledge funding from the Government of Canada for various stages of this research, and also the research assistants who have worked on this research, in addition to Sara, of course. So I'll ask Sara to introduce Carrier-Sacani Family Services next.
Thank you. So Carrier County Family Services is an Indigenous Child and Family Services agency that was established in 1990. CSFS serves 11 member nations, and their traditional territory spans over 76,000 square kilometers across north central BC. CSFS's ultimate goal is to achieve self-governance for its member nations, and they are currently working towards that goal through the provision of a multitude of health, social, and legal programs across the carrier life cycle. Culture is truly at the heart of Carrier County's work, so they really work to ensure that all services are culturally relevant while meeting high service standards. And this effort and care is reflected in the multiple awards that CSFS has received for service excellence related to Indigenous family care and reconciliation efforts. CSFS worked really diligently and tirelessly to advocate for its member nations and the communities that they serve. So when a need is identified, or when there is a gap in services, or where current services aren't meeting community needs, Carrier County will find a way to address it and to fill those gaps to best serve their nations. They truly provide some incredible programs, and if we had more time, I would highlight some of their services. But I do encourage you to take a look at their website to get a better understanding of the breadth and scope of their work. As it relates to the Highway of Tears, Carrier County is a key agency that's leading and advancing this important work. And we can advance to the next slide.
Great. I will say a little bit about the Northern Feminist Institute for Research and Evaluation, which is the other partner which I represent here. We're a longstanding research institute at UNBC, originally founded as part of the BC Centre for Excellence for Women's Health. But for the past 2 decades, it's been an independent research institute. And our mission is to raise awareness about women's experiences with the health care system, create a women-centered and gender-sensitive approach to determinants of health, connect researchers, engage and mentor students and community researchers, disseminate information, resources, and knowledge, and finally, the points that you see on this slide, which are directly relevant to this work. So we are explicitly a community-facing research institute, and that's why we're particularly honored to be part of this work. So we can move to the next one. And then over to Sara.
So the Highway of Tears is a 742-kilometer stretch of highway on Highway 16, and that's between Prince George and Prince Rupert. And along this particular stretch of highway, which is highlighted on the image here, there are 23 First Nation communities located directly next to or in close vicinity to Highway 16. The Highway of Tears got its name in reference to the number of mostly Indigenous women and girls who have gone missing or who have been murdered along this stretch of highway. And the name reflects the fear, frustration, and sorrow of the communities along Highway 16 due to the experiences of missing, murdered Indigenous women and girls. We can proceed to the next slide. Thanks. So since 1969, between an estimated 30 to 50 women and girls have disappeared or been murdered along Highway 16. And the kind of difference in the estimates reflects the discrepancy between official and community-based records. So RCMP only considers a case as part of the Highway of Tears if it occurred within 1 mile of the highway, while advocates for Highway 16 really advocate for a broader definition to reflect the larger pattern of disappearances throughout northern BC. So most of the women who have disappeared were Indigenous and were hitchhiking when they went missing. In June 2002, a post-secondary student named Nicole Hoare disappeared along Highway 16. So she was tree planting in northern BC during the summer and was hoping to hitchhike from Prince George to visit her sister in Smithers, which is about 4 hours east of PG. and she vanished. And her disappearance received extensive media attention and had a really quick and coordinated RCMP response. In contrast, earlier that year in February, a 14-year-old Indigenous gal named Ayla Sarah August went missing, and she was found 8 days later deceased in a ditch along Highway 16. She did not receive the same level of media attention nor the investigative supports that Nicole's case did. And this really marked kind of a turning point, bringing national attention to the term Highway of Tears and to the broader crisis of missing murdered Indigenous women and girls. And it also exposed inequities in how cases involving Indigenous women are addressed and how they're often shaped by discriminatory assumptions or receive limited investigative attention. So we can move to the next slide, please. So the contrast between Ayla and Nicole's cases really mobilized activists along Highway 16 to put on the Highway of Tears Symposium. So this symposium brought together government officials from all levels of government, as well as the RCMP, community members, First Nation agencies, and frontline workers, as well as the families of Highway of Tears victims to put pressure on the government to enhance safety along Highway 16, to address the underlying socioeconomic inequities that make hitchhiking necessary for people living along the Highway 16 corridor, as well as to prevent discriminatory policing practices related to Indigenous women and girls. The symposium had 500 attendees. Sorry, there's an arrow on the slide, 500 attended. And attendees were asked, what could have been done better for your family during your time of loss? And if we move to the next slide, you'll see that this question informed the Highway of Tears Symposium report. So this report outlines 33 recommendations aimed at preventing violence and improving safety along Highway 16, particularly for the communities located next to it. And the recommendations were put into 4 categories. So the first one is victim prevention. And this really focuses on reducing the risk along Highway 16 by protecting women who are hitchhiking and addressing those underlying conditions that make hitchhiking necessary. So this includes poverty, limited access to services, and lack of youth opportunities throughout some First Nation communities. The second category, emergency readiness and team response, calls for a coordinated readiness plan between different communities and the RCMP to enable them to respond rapidly to disappearances along Highway 16. And this is to be supported by kind of more long-term integration into municipal and First Nations governance. And then the third category, related to victim, family, and counseling support, requires culturally grounded care for communities when they experience crises. So this could be like deaths by suicide, anything that could be really considered kind of a tragedy for community. And then the fourth and final category covers recommendations that emphasize coordinated governance structures to oversee the recommendation implementation, to align funding, and to secure or ensure accountability across all initiatives. And we can move to the next slide.
Great. So now that Sara has introduced the context and the kind of vital foundation that was established by the 2006 symposium, I want to turn to the partnership we've been engaged in recently with Carrier Sekani. So Northern Fire's work overall has been focused on research, evaluation, and advocacy in partnership with community organizations as befits the mission that I told you about. And what you see on the right-hand side of the screen is a model developed by the Tamarack Institute to articulate a kind of continuum of collaboration, if you like. And at Northern Fire, we're trying to move beyond the left-hand side, but beyond the center. We're trying to move to the right-hand side of this spectrum where we work with organizations that have complementary missions on projects that are designed with community and responsive to community. And so our goal is really becoming to respond to expressed community needs wherever possible, rather than ourselves articulating what those needs might be. So we can move to the next one, please. Could we move to the next slide, please? Sorry. Yes, there it is. Perfect. Oh, no, the previous one. Thank you. So I just want to show you how that's worked in the past few years. So Northern Fire was approached by Carrier County Family Services in fall 2022 in partnership with families of Highway of Tears victims and the CSFS, Calls for Justice Department. From there, we iteratively generated a research plan and research design, went on to hire researchers, graduate students, completed ethics training and applications, and commenced our research. And the goals were articulated by the partner. The goals were to update the data on MMIWG plus in Northern BC, to scan MMIWG plus prevention initiatives in English-speaking North America, and to evaluate their effectiveness. And finally, to scan Northern BC initiatives, goals, and approaches through Indigenous community focus groups. And the outcome is listed below, and we can turn to the next slide. So the outcome is the roughly 100-page report that you see here, which is publicly available on the CSFS website. And it really aims to move prevention forward in Northern BC communities. It contains 36 recommendations, which are based both on an environmental scan and lit review and on the community focus groups that we articulated in various Indigenous communities. So the report contains numerous findings, as you would expect from its length, but I want to highlight a few key ones. The first is the need for program evaluation. Our environmental scan was supposed to assess not only the existence of prevention programs, but their effectiveness. And what we found is that, likely because of funding gaps, and also likely because of the need for modes of evaluation that are culturally appropriate, what we found is that evaluation is often lacking. And in fact, programs come and go on the basis of criteria other than whether they're effective, which can be very frustrating for communities. A second issue is the relative lack of programs that are specifically identified or designated as MMIWG plus prevention programs. That makes it very difficult to share best practices from community to community. So there is a need to not only prioritize that kind of program, but to expand our ideas of what that kind of program can look like, and to make sure that we are articulating that one of the goals, if not the primary goal of Program X, is MMIWG plus prevention. A third issue emergent from both the environmental scan and the focus groups is the importance of cultural revitalization itself as prevention, particularly but not only for youth. So revitalizing community trust and cohesion and providing specific Indigenous cultural programming are both key to prevention and safeguarding. As one participant put it, you've got all these young girls running around looking for, as many have said, looking for love and acceptance. And you know they have to find that with each other and in ceremony too. So training in ceremony, traditional cultural roles and responsibilities, etc., should be understood and tracked as prevention. The need to engage men and boys also emerged strongly from the scan, and even more strongly from our focus groups. And I should note here that most of our participants were women. Here it is critical, I think, that the work be carried out in a culturally relevant way. Work with men and boys generally often aims at gender equality, including things like equal participation in care work and critiquing norms of masculinity. But what we heard in community is that our participants wanted men to maintain a distinctive role, that is, to reassume their roles as protectors who stand around the circle, as many of them put it, and as providers who serve the community, rather than becoming equal partners in domestic or caregiving tasks. So that is, when we think about this, we have to think about how gender complementary approaches may be the most effective and the most in accordance with the norms of a particular community. That might actually be true outside Indigenous contexts too, but we heard about it loud and clear. Finally, our participants consistently expressed concern about missing men and boys and the need to incorporate them into the ways we address this issue. Finally, the importance of infrastructure is often overlooked in the literature on MMIWG plus prevention, but it came through loud and clear in our focus groups, partly as a result of the kind of region we're in, as I'll discuss in a moment. Physical infrastructure is absolutely critical to MMIWG plus prevention, and it's often overlooked in studies that emanate from urban settings. So we can move to the next one. So our report also attempted to verify and update data relating to cases of missing and murdered Indigenous women, girls, and gender minorities in Northern BC. As of 2012, Human Rights Watch said that Northern BC had the highest rates of unsolved murders of Indigenous women and girls in Canada. So we were anxious to respond to the call for better data. Our work identified 69 cases from 1967 to 2023 in the region, of which 68 cases were females and one was a gender minority. Many of these cases, unlike the broader Highway of Tears cases that you heard about from Sara, were solved, and many do not fit the profile, the RCMP profile of the Highway of Tears cases, but they allowed us to better understand the scope of the issue in our region. So the average age of victims was 28.8 years, but this concealed a wide variation from ages 4 to 89. Girls aged 12 to 19 were particularly represented within the age group, and the most common age of victims overall was 18. So we know that young women, especially teenage girls, are especially vulnerable. We also know that there are seasons that are particularly dangerous. So disappearances were most common in June to September. There are a lot of reasons why that could be so, and we could talk about that if you're interested. And Prince George and Williams Lake are frequent last seen locations, regardless of where girls and women come from. So we also know that there are hotspots of vulnerability around Prince George and Williams Lake. So we identified the need for much better data collection, and we see this as ongoing work, but we also identified regional risk factors. Northern BC is unique. It is characterized by its vastness. It's the size of France, and it has, maybe 250,000 people. Now, within Canada, that's not unique, right? We have other regions that are like that. However, Northern BC has a very challenging geography, including multiple mountain ranges, many rivers, and many remote communities. There are few roads because of the geography, and Indigenous nations are dispersed in small independent reserves because much of BC is not covered by treaty. So we have, kind of historical and geographical factors that interact to produce this unique situation. There's also really limited infrastructure throughout the region, and services are concentrated in large centers, particularly Prince George. The region is marked by poor connectivity and cell service. Up until only last year, the Highway of Tears itself had very intermittent and spotty cell service. Northern rural and remote communities have their own risk factors for violence, such as isolation, unemployment, lack of services, lack of privacy and confidentiality, and delayed emergency response. And so violence is more prevalent in our region. And finally, our regional economy is driven by resources and trades-based industries, with many workers employed in rotational camp-based roles and moving in and out of community. And the presence of these industries can lead to social and economic changes within Indigenous communities, including associated risks of exploitation, violence, and substance use. So Northern BC has a really, I would claim, a unique context. We can turn to the next slide. And here I just want to highlight that in addition to our specific risk factors and their kind of unique combination in Northern BC, we have an urgent need for prevention, as demonstrated by recent statistics from BC. So the statistics you see on the screen are from the report on the right, And it should be noted that while the crime rate in BC dropped in 2024, this was driven primarily by property crime. So the 10-year trend is still toward more crime and greater crime severity, particularly within certain regions. So if you look at the first bullet, you can see that while in BC the total violent offenses rate went up 38% over a decade, in our region, the region centered on Prince George, that corresponding number was 67.5. And this is very typical of crime, provincial crime indicators and how they're expressed in the north. So while hitchhiking may have declined within the province and within northern BC, that's not an indication of safety or protection, as these data show. So we can turn to the next slide, please. So Sara has mentioned the first Highway of Tears Symposium report, and I've mentioned the 36 recommendations of the 2025 report. What we're working on now is 2 of those recommendations. The first was a need to assess progress on the 2006 recommendations. That came through from communities and surprised us. People actually said, we need to know what has been done since 2006 and what hasn't been done. We need to know how complete those recommendations are and to assess whether they're still relevant. So that's one of the things we're working on. The second is to host a follow-up symposium 20 years after the first one, again to consult community and working with the delegates at the symposium to craft a path forward to the region, a follow-up 2026 version of the original Highway of Tears report. So that's what's happening next week. And the symposium data are going to be a vital part of what we do to assess progress. That said, we've been working on our review of the 2006 recommendations and the progress made on them since the fall by hosting focus groups in Indigenous communities and by conducting a scan and online survey. And so we can move to the next slide. So Sara is now going to walk you through the recommendations and progress on them based on her environmental scan and lit review. And I'll just invite you to think about the relevance of the recommendations to your own communities, because some of them may be unique, but many of them are translatable.
Wonderful, thank you. And we can move to the next slide. So I should preface this as well with we haven't yet had a chance to kind of share this progress at the symposium. So the kind of criteria that I'm sharing here and the categorizations are based on kind of my interpretation of the data, but that would need to be validated by community. And I anticipate that some of this might change. But when I was conducting the literature review and the environmental scan, I found that there was pretty limited publicly available information that directly ties to the implementation of these recommendations. And at a first glance, it kind of felt like not a lot has been done. And in many cases, that is true. And that's particularly true for recommendations that require like coordinated system level responses. But it also became clear that the progress has like some has occurred in ways that are not necessarily like directly related to the Highway of Tears Symposium report and recommendations. So much of this progress reflects kind of sustained advocacy at the provincial and federal level by Carriers County Family Services, as well as agencies like the First Nations Child and Family Caring Society, to secure more equitable funding for services and supports that address the kind of underlying conditions linked to risk along the highway. And so these efforts really advance prevention-based funding models and post-majority supports through Indigenous Services Canada, as well as equitable access to healthcare for Indigenous children and youth through mechanisms like Jordan's Principle. And completing this review was really a reminder that the Highway of Tears is situated at the intersection of gender-based violence, systemic inequities, and barriers to accessing services and opportunities in the North. So it was really important to account for where progress has occurred, even if indirectly, to recognize the hard work that has gone into supporting the intent of these recommendations, while also identifying and honoring that gaps remain. and to highlight where more action is needed. So this kind of informed how I categorized progress. So the first is no progress. So I use this when there's no evidence of any action directly tied to the recommendations since 2006. Little progress captures kind of limited activity that has not resulted in any meaningful advancement, particularly for the perspectives of affected communities. And then moderate progress reflects that meaningful steps have been taken, but that implementation remains partial. Significant progress reflects, again, substantial advancement. So some elements within each recommendation might be outstanding, and then completion reflects that the recommendation has been met and fully reflects their intent. So we can move to the next slide. And this here is just a quick little snapshot of kind of the progress that's been made. So in 20 years since the first report, only 2 recommendations have been fully met. 5 show no progress, and the majority kind of are in that moderate to little progress range, indicating that implementation has been uneven and largely incomplete. If we go to the next slide, we can kind of break it down on comparing the 4 different categories that the recommendations fall under. So the categories with the least progress include the emergency readiness and team response, victim family counseling and support, and community development and support. And these are also the categories that really depend on like coordinated cross-jurisdictional action. So they require like formal governance structures, defined protocols between community and external rights holders, like the RCMP, as well as shared accountability across rights holders and sustained funding mechanisms. And they require that these coordinated mechanisms be activated in real time with really clearly defined roles and timelines and communication pathways. So they're quite complex, like system level changes. Whereas the victim prevention section contains both kind of like the strongest progress. So this is where we see completed recommendations and recommendations with significant progress. But we also have the greatest number of unaddressed recommendations. Um, and I think this really highlights how uneven implementation can be within each category. The recommendations that did reach completion or are close to completion tend to be those that could be advanced at kind of like the community, agency, or specific ministry level. And they remain substantial, or there remains like substantial and important asks in this section, but they haven't seen a lot of movement. And those primarily fall under the ownership of the RCMP. So this, when I was looking at this, it really piqued my interest to look kind of more closely at how progress varied depending on the lead system responsible for implementation. So if we move to the next slide, it's kind of, I've broken down the progress by agency type. So again, we'll see that the recommendations that have seen the most progress are the ones that have been led by Indigenous Child and Family Services agencies. And conversely, most of the recommendations that are tied to RCMP, the public sector, and private industry remain at little or no progress. You will see some green in the public and private sector industry. And it's important to kind of like look at the nuances behind that. So for example, in the public sector, the recommendation related to, or that's like achieved significant progress, was related to implementing community shuttles between some of the communities along the Highway of Tears. And while this technically supports part of the first recommendation, or recommendation 1, it also led to Greyhound's withdrawal of services from northern BC, which eliminated twice daily bus route between Prince George and Prince Rupert. So on the one hand, it's considered kind of a win because now there's communities can travel between one another easier. But it also is kind of a bit of a step back from where we first started because now there is only you can get between Prince George and Prince Rupert twice weekly now, as opposed to twice a day. And then similarly for private industry, TELUS and Rogers did work to expand cell service across the corridor. And like Dr. Holler mentioned earlier, this happened very recently within the last year. And while this does improve safety, it took close to 2 decades to implement. And anecdotally, there are still a lot of dead zones along the route. So even within areas categorized as significant process or progress, the outcomes are more complex and implementation has been delayed and uneven, and in some cases has created new gaps. If you can move to the next slide, we will explore some of the recommendations that have not had any movement. And again, what stands out is a lot were directed towards law enforcement. So a lot of the recommendations, kind of under the purview of RCMP, haven't seen much motion. Despite this, the province did provide $230 million in funding to the RCMP in 2022 to strengthen rural policing. So this includes like highway patrol as well as missing persons investigations, which sounds really great and like it's in alignment with some of the Highway of Tears recommendations. But 15% of that 230 million was actually allocated to the community industry response group. And so this is like a specialized RCMP unit that responds to protests in opposition to resource development projects. So in practice, this has often meant that folks are policing Indigenous land defenders and community members who are asserting rights and titles. And surge operations have been like widely criticized for the use of surveillance, arrest, and enforcement tactics in Indigenous communities. So from that 230 million in funding that went towards rural policing, 37 million of that was spent on the Morris, like on policing the Morris Forest Service Road, which is a road that intersects with the Highway of Tears. And so this is a photo taken in relation to kind of that context. So it's in the context of the Highway of Tears, it really raises some concerns about how policing resources are being used. If we move to the next slide, um, we'll see here the recommendations. Oof, I'm sorry for that spelling error. Should say little progress. But these recommendations have seen little progress overall. And again, these are recommendations that require multi-agency collaboration. I'm not going to go over them all in depth. Um, what I will say is what stood out to me is recommendation 10, which relates to post-secondary institutions as well as secondary schools across the corridor. And they were encouraged to put on annual prevention and awareness campaigns in the school districts. Uh, to date, not a lot of work has been done to support that. And so, for example, one school across the corridor just last year started acknowledging Red Dress Day through a single social media post. And again, that's not necessarily a Highway of Tears designated awareness or prevention initiative. And really reflects some of the gaps as it relates to supporting that prevention for children and youth and young adults along the corridor. You can proceed to the next slide. So these recommendations here reflect the ones that have achieved moderate progress. So they've seen meaningful movement, but may not be officially operationalized in policy. So for example, recommendation 20 requests support from search and rescue to support MMWIG plus cases. And while search and rescue is often utilized in Northern BC, nothing is formally operationalized in policy or mandated across jurisdictions to ensure consistent support for these cases. Some of the other recommendations here are operationalized, but are kind of patchworked, or again, not necessarily specific to Highway 16. So for example, recommendation 22 focuses on creating a First Nations-led crisis response. Again, this is to support communities following tragedy. And there are a lot of agencies that provide these culturally informed and culturally relevant supports, but they're often not coordinated. So, for example, you have FNHA, CSFS has their own kind of critical incident stress management response, and the Red Cross can also be deployed to provide culturally safe care in these situations, but they're fragmented, and this can often lead to duplication of services or gaps during critical incidents. I've highlighted here kind of on the like this image, and this is an example of a more like a national level initiative that is supporting the work of the Highway of Tears recommendations. So this is related to recommendation 18, which is a missing person alert system. And this was something that was supported by MPs in northern BC. And the red dress alert is a proposed emergency alert system to notify the public when an Indigenous woman, girl, or two-spirit individual goes missing. So it works like an Amber Alert, and there's currently a pilot project related to this in Manitoba. So again, there's pieces of these recommendations that are happening, but they're not necessarily coordinated nor intentionally related to the Highway of Tears. We can move to the next slide. Can we move one more slide over? Perfect. So recommendations that have seen significant progress. Um, relate again to a lot of the work that organizations like CSFS have supported. So if we look at recommendation 6, which is to establish safe homes along the highway, Carrier County is currently supporting this recommendation. They're working with each of their member nations to establish a clan house, and this will provide culturally safe supports for children in care, for families involved with the Ministry of Children and Family Development, and it can also serve as a safe home for women who might be needing to flee domestic violence. CSFS has also created a toolkit to support recommendation 11. And so this is kind of like a handbook that outlines supports for communities if family members or community members have gone missing. So it provides information on how to report a missing loved one. There's like tips related to advocacy as well as supports in navigating the various systems involved. And Curious County is currently adapting this to serve as a national toolkit. The Kermode Friendship Center, which is based in Terrace, which is also located along Highway 16, has recently also launched their own MMIWG toolkit. And overall, these efforts really reflect like strong community-led progress. But again, much of this work continues to rely on Indigenous organizations. And if we again consider recommendation number 1, yes, some shuttles have been implemented. Some great work has been done to support that piece, but there have been kind of unintended consequences bringing us steps back. And then we'll move on to the next slide, please. Sorry, if we can advance one more. So these are the 2 recommendations that are complete. So recommendation 9 called for billboards with 1-800 reporting and safety information to be included across the highway. And then recommendation 14 was specific to media campaigns focused on awareness and prevention. And so Curious County has done, again, a lot of the legwork in supporting recommendation 14 and 9. They, like CSFS has worked to, they've I think co-produced a documentary that was featured at the Toronto International Film Festival related to the Highway of Tears. They've participated in a lot of radio campaigns, as well as they've secured like international coverage through magazine like articles related to the Highway of Tears. And then recently with the billboards, they've really shifted away. So there was previous iterations that really focused on kind of like deterrence, recognizing that hitchhiking remains a necessity in many communities. CSFS has now introduced new billboards that kind of inspire messages of hope, resilience, and strength. Can you, sorry, just advance one more slide? Yeah, sorry. So here is the examples. So at the top is the kind of older, more outdated billboards. So you can see there's a lot of, I would say, kind of victim blaming language on these billboards. And then the newer ones on the bottom reflect that more optimistic messaging. It is important to note that not all advocates and families connected to the Highway of Tears support this shift in messaging. So for example, Gladys Reddick, who's the auntie of Tamara Chapman, she's an Indigenous woman who went missing in 2005, emphasizes that the name like Highway of Tears is both internationally recognized and for many families really captures like their lived experience and that it doesn't always feel like there's a lot of hope. So while CSFS has played a significant role in advancing awareness through these media campaigns, it's also important to kind of consider those nuances. And with that, I'll pass it back over to Dr. Holler.
Thank you. So if we can move to the next slide, please. I just want to tell you very briefly about the the structure of our research. So we conducted focus groups through the fall in Indigenous communities. You see a recruitment poster here for one of those groups. And those involved about 60 participants in 6 communities along Highway 16, but they represented many more Indigenous communities because we put them in the larger centers and people came to them from various small communities. So we're still coding the results, which are very rich, as you might imagine, from those focus groups. If you turn to the next slide, we are also currently deploying an online survey. As of today, it has another 60 participants. So we're really building the body of our data. And again, this survey asks participants to assess the progress and the continued relevance of the recommendations, which is really important leading into the symposium. And so it permits both you can kind of rating and box ticking, but also qualitative comments. So if you turn to the next slide, you can get a sense, if you click again, yeah, you can get a sense of the kinds of results we're getting there. So for example, we're seeing how important people think issues are. As you can see at the bottom, extended cell coverage is still a huge issue for people. People think it's very important. And we're also getting some feedback on how they feel progress has gone, and we're seeing a lot of disagreement. So that'll be very interesting. But what you see here is the kind of qualitative commentary that we're getting in the survey. And so we're going to see, when I look at this, I see real saturation on certain issues. We're hearing about a lot of issues in community and on the survey that are the same, but it's going to take a long time to go through all of these rich data from the qualitative comments. So moving to the next slide, please. We can kind of talk about where are we at this point, even if on the new report and on the symposium, we're in a kind of preliminary space. Well, I think Sara's literature review and scan allows us to, preliminarily, if that's a word, rate progress. But as I said, when we turn to the focus groups and the surveys, there's quite a bit of disagreement among community members and from community to community concerning how much progress has been made on particular recommendations and overall. So we've had people saying no progress has been made, both in focus groups and in the online survey. And then we've had other people say, well, really significant progress has been made. There's still more to be done. So what we are seeing here is definitely the need for research that's going to try to build some kind of consensus. There's also this continued gap in program evaluation that just keeps coming up again and again, as in our 2025 research. So that said, in our focus groups and in our survey, though our analysis isn't complete yet, we can already see strong consensus on some things. And having heard Sara, I think they won't surprise you that much. So if we look at the things that were ranked very important in the online survey, that is more than 70% agreement that they're very important, which is very high. We can see the following, and these are in ranked order. So extended cell coverage is the top, and it came up in every focus group as well. Improved delivery of social and health services in the North. This is critical not only so that people can access resources that will help them to avoid violence, but so they're not traveling in precarious ways to get to services, which, that transportation precarity constantly exposes them to the risk of violence. The need for a First Nations advocate to work with the RCMP remains as salient today as it was 20 years ago, as does the ongoing RCMP compilation of regional missing persons lists. This is still very fragmented, and it's a considerable source of pain and confusion, I would say, for communities, and it prevents communities from working together. Working with youth remains really important. As does the existence of trauma response plans for First Nations communities. Again, some of these exist, but they do not exist kind of system-wide or region-wide. And then finally, the improved bus service remains critical. So people are very positive about BC Bus. One thing about it is that it's very cheap compared to Greyhound. Greyhound used to be a very expensive option, right? It was frequent, but it was expensive. So the new bus service is inexpensive. That's wonderful, but everyone says it's too infrequent, as Sara already noted. So this remains a huge issue. So we see service delivery infrastructure, and policing coming to the fore as prevention strategies. And that suggests that we have to expand our concept of violent prevention, obviously far beyond the interpersonal to the deeply contextual and the systems level. And we're hopeful that, next week's colloquium is going to add more nuance to these findings and permit the development of a really robust report. And again, we see this key challenge for future research in implementing rigorous and culturally appropriate evaluation mechanisms so that we know not only how far we've come, but also, how much this is relevant to the communities that it's serving. So we can turn to the next slide, which is our penultimate one, which is, really to tell you about the next steps in this process. As I've said from the start, our process is highly iterative. So we have consultation at each step, and I think that enriches the outcome, but it does tend to make things slower. So you can't expect the final report until this time next year, probably. But the Highway of Tears Symposium is next week. We're going to present our results and collect more data and feedback. Data and analysis will continue through the summer. And then we take this work back to the communities and get their feedback again. So the final report and recommendations should be available in winter 2027. And we just would encourage you to keep up with our work. And what you see on the slide is not only my email address, but the website of CSFS and actually their Facebook page, which I find quite inspiring. It really gives you a sense of how active they are in implementing a lot of the kinds of programs that we're thinking of as key prevention strategies. So with that, I think we can leave it. We'll move to the next slide and say a very warm thank you. And now we are very happy to take comments or questions from the audience.
Jacqueline, Sara, thank you so much for such an important and compelling presentation. I know I always learn so much from your work, and I'm sure our viewers did as well. The one thing I was wondering while we wait for some questions to come in from the audience is if you could provide a bit more background or context, because a lot of our viewers are actually from Alberta and from Ontario, about what life is like in northern BC and why these challenges are so unique.
Mm-hmm. Well, I think, we think northern BC is wonderful. It's beautiful. It's really an exceptional place in many ways. And the traditional territories up here are rich and vibrant places and highly diverse. But that's kind of, that's a great strength. And also, I would say a weakness from a prevention point of view, because as I mentioned, if you're from the prairies, for example, you're used to treaty organized territories that are very large, right? They might include a lot of communities, but they have a lot of coordination amongst them. Again, because of the lack of a treaty process in BC, with the exception of the Peace River country, which is covered by Treaty 8. What we have is small communities with very small reserves. They often need to, say hitchhike to get to visit family on another small reserve. There's very limited coordination and shared governance across the nation. So Carrier Sakani as an umbrella organization can provide a lot of that, but there is a kind of unique challenge, right? That's historical. And then, as I also mentioned, the particular geography up here is really challenging. And though northern BC actually is the engine in many ways of the BC economy, we generate, the hydroelectric power, the oil, the natural gas, all those things, the logs. Despite that, we do not see the kind of investment we need in making services broadly available. And so the solution has been to take Prince George, which is a city of between 80 and 100,000 people, and to centralize all services for this entire region the size of France in PG. That includes obviously, a lot of things like major court services, but also just day-to-day health, counseling, all of those kinds of things. And so you have a real situation of precarity with regard to access to services, coexisting with this beautiful land that people come from all over the world to see, right? So I think it's really it's unique in that regard. Although I'm very aware that, participants from Alberta and Saskatchewan will say, "Oh, well, I recognize some of those
Yeah,
challenges." Absolutely. And I should also add the weather. The weather's a challenge too, particularly when it comes to things like transportation. It adds to the precarity of people, right? In a way that, for example, you need to have a really good car up here, right? So it's not just car ownership that might be a barrier. It's that if you drive a beater, you're not going anywhere in the winter, right? So, so yeah, it has some special challenges, some of which people will recognize from other places, and others I think are unique.
absolutely. And only been once. It was actually, Jacqueline, for something that you hosted maybe 10 or so years ago when we first met. And I remember being taken away both by the beauty, but also it's when you see it in person, it's so different where you realize the transportation challenges and the safety challenges that might come with everyone being so spread apart without bus access, without reliable car access. It's a very unique culture and geographical area. So someone,
Yeah.
oh, sorry, no, continue.
Oh, sorry.
No, please go
I
ahead.
was just going to say, and I was just going to say that the other part that I should mention about that is that, the region is very beautiful, but if you come to Prince George, you see both the concentration of services and the concentration of pain. So we have a lot of challenges in our community with gangs, with drugs, with violence, right? So we are the hub in more ways than one. So yeah, thanks. So you have another question.
Yeah, someone sent it to me via email because they couldn't figure out how to use the Q&A. So someone was asking Sarah that as an ally and as a new researcher, what are good steps that someone can take your approach? So the grounded and Indigenous-led, trauma-informed, and community-based approaches. What are good steps for people to take who are just embarking on learning about those things and implementing them in their research?
That's a great question. I'm like, can someone answer that for me? No, I find I feel very privileged in that I've had the opportunity I've worked for Carrier Sakani, as well as a couple other First Nations in the North. So I've worked for Sake Dene. And so through that work experience, like I have a strong understanding, of kind of, protocols, and I have strong relationships with folks from the different communities and agencies. And I think that's been really helpful. For example, I don't think this literature review would have been, straightforward if I didn't have that context from my past work experiences. So I guess like my recommendations would be like really, focus on establishing relationships, meaningful relationships, that are not self-serving, and that are really kind of grounded and informed by the community that you're working with. Um, yeah, I think too, like I've had work experience trying to, promote some more Indigenous-based system responses as it relates to child maltreatment. And I've seen firsthand kind of the pushback that Indigenous agencies experience. Conversely, when I worked in post-secondary, it was so easy to collaborate with some of those broader systems. So I think even at that institutional level, there's still some inequities in how collaboration is supported. And so having kind of that background context, though not nearly to the same extent of the communities that we're serving, is really helpful in understanding some of the barriers. I don't know that that answers the question, but I'd say, definitely seek some mentors and really, focus on connecting with community.
That's beautifully said. And Jacqueline, I know your work is very much the same. Do you have any recommendations?
Well, I would say, and Sarah's answer makes it clear why I was so excited to recruit her for this project. But I would say just opening the door to relationship has been super beneficial for me over the years. I would say I kind of crept into this work slowly and cautiously, right? Because, I didn't think I honestly didn't think I was qualified to participate in this kind of work. And then over the years through my work with Northern Fire, and Sarah, you mentioned coming to Prince George. We've hosted conferences and symposia in which we really try to bring communities together. And you just meet people and they start saying,
Yeah.
"Hey, why don't you start working on this?" And then all of a sudden it becomes, you know, as I mentioned, responding to what someone else wants rather than coming in as, the person from the university on the hill saying, hey, I've got an idea, right? So I think opening the door to relationship and then preparing yourself to be led um, by the other, I think is what's been my path.
That's so well said. And that brings up for me, I was speaking with someone who does similar work in another region in the country, and they say it takes 100 cups of tea to get to know somebody before you can start to work with them. And I'm like, that's a beautiful sentiment that I think both of you are raising.
Yeah, absolutely.
So Ken in the chat or in the Q&A has asked, there has been little movement on the recommendations on the mass casualty report out of Nova Scotia too, and I see similarities in some of the solutions that may stretch into murdered and missing women's report recommendations. Do you have any considerations in using the casualty report to gain momentum and achieving gains for both at the same time?
Wow, that is, I mean, I think that's a really brilliant suggestion. And so, at the beginning, when I kind of clumsily talked about a web and little nodes and how we should all be connected, I think Ken's suggestion is a great one. Um, in Northern BC, none of this would have happened without the first symposium. So I think galvanizing a region and bringing that public pressure to bear is a strategy that we can all share. But I love the idea of linking those things, and I'm going to take that away from here to our partners and talk about it.
Yeah, it's something I had never considered either. So thank you, Ken. That's an excellent point. I think that brings us to the end of the Q&A. So for folks who are still here, please make sure to take the survey and then head on out. And Jacqueline and Sarah, on behalf of Ava and myself, thank you. It's been so amazing to learn from you again today and to have these conversations.
Thank you. It's been a real honor to be here, and thanks to the audience.
Thank you.